Breast cancer tumor receptors are an important piece of the puzzle in deciding your treatment options. We will teach you all about it. If you've been diagnosed with an invasive breast cancer, you've likely heard the terms estrogen receptors, progesterone receptors, or HER2 receptors. These are the receptors that help determine if you will benefit from hormonal therapy and even chemotherapy. The sooner you learn these concepts, the more quickly you will feel at ease with the treatment decisions ahead. In this lesson, I'm going to teach you about breast cancer receptors, why they are so important, receptors that suggest you might benefit from hormonal therapy, receptor patterns that suggest that you might need chemotherapy, and I'm also going to review the benefits of neoadjuvant chemotherapy. Hang in there with all of these terms. I'll explain it all to you. So let's get started. What are breast cancer receptors and why are they so important? Well, receptors are a huge piece of the puzzle in determining how to treat your breast cancer in conjunction with the stage of your breast cancer, the grade of your breast cancer, the type of your breast cancer. So the way to think about receptors, they are little proteins, but I kind of think of them as little light switches or growth switches on the surface of a cancer cell. So if you have a cancer cell, they have little growth switches that can be in the on position to make it grow, meaning not grow big, but one cell becomes two, two becomes four. That's how cancer grows. When the light switches are turned off or blocked, then it can keep the cell from growing or even make the cell die. So let me walk you through it. There are two receptors that I'm going to talk about, estrogen receptors and HER2 receptors. Progesterone receptors are a little less important. Estrogen receptors, think of them as that if you have an estrogen positive cancer, the surface of your cancer cells have a whole bunch of growth switches in the on position. And using hormonal therapy, we can target these little light switches and turn them off. And that keeps the cancer cells from growing and in fact kills cancer cells. So estrogen positive breast cancer with lots of these little growth light switches are present, and we can treat it with hormonal therapy, estrogen blocking drugs. The second type of receptor is a hair different. Think of your breast cancer cell, and the HER2 receptor is present, and it's always in the on position. Most breast cancers are HER2 negative, so they're not on the surface of a cancer cell. But if you have a whole bunch of these HER2 proteins, little growth switches, on the surface, that's a fast-growing tumor. And we now have chemotherapy and targeted therapy to go after these little cells to then target the cells to die, to kill those cells. So that's a HER2 positive cancer. About 20% of all cancers are HER2 positive. And estrogen receptor positive cancers encompass about 80% of all breast cancers. Some breast cancers can be estrogen receptor positive and HER2 positive. Some can be both negative. So it's kind of complicated, and I'll get to that next. What breast cancer receptors suggest hormonal therapy? Remember this principle. If you have an estrogen receptor positive, ER positive breast cancer, you will benefit from 5 to 10 years of hormonal therapy. So that is the principle going forward. However, there are a few exceptions. If you have an ER positive tumor, it's still possible you might benefit from chemotherapy in a couple of situations. Let's say you have an ER positive tumor, but the doctor tells you that you're HER2 positive. Well, you're probably going to benefit from chemotherapy and targeted immunotherapy, followed by hormonal therapy. Let's say you have an ER positive cancer and it's a very favorable cancer. We can now use genomic assays, very sophisticated ways to look inside your cancer cells to better determine if that cancer, which is ER positive, not suggesting chemotherapy, will actually benefit from chemotherapy. It's a big advance in breast cancer care. So all of this is very complicated. If you need hormonal therapy, most likely that's the only thing you'll need. But many patients will need chemotherapy and hormonal therapy, and I'll cover that next. What receptors in breast cancer suggest you will need chemotherapy? Well, there are two main principles. Number one, if you're estrogen receptor negative, you will likely benefit from chemotherapy. If you are HER2 positive, you will likely benefit from chemotherapy and targeted immunotherapy. There's a third situation which you might have heard about, triple negative breast cancer. And that means that the estrogen, progesterone, and HER2 receptors are all negative. That's an aggressive cancer. That is a cancer that is also benefits from chemotherapy. Chemotherapy is one of the most complex decisions that your medical oncologist has to make and you will ever have to make. And your receptor pattern is just one piece of the many different pieces of the puzzle that will determine whether or not you will benefit from chemotherapy. What are the benefits of chemotherapy before surgery if my receptors suggest that I need chemotherapy? Well, if your biopsy, your initial biopsy, determine if you have cancer, after they find that it's cancer under the microscope, the pathologist will run your receptors on those small bits of tissue. And if your receptor pattern is screaming that you're going to need chemotherapy, such as it's estrogen receptor negative, or HER2 positive, or triple negative, you want to know. And unfortunately, a lot of patients are not told up front when those receptors come back that chemotherapy is in their future to be recommended to treat their cancer. So remember, chemotherapy, the decision for chemotherapy is a complex one. But if you have one of these receptor patterns, you want to know because it's worth asking your surgeon, if I'll need chemotherapy, what are my receptors? And if I do need chemotherapy, and you know that's coming, will I benefit from neoadjuvant chemotherapy, which means chemotherapy starting it quickly before surgery rather than waiting a month to get to surgery, waiting a month to recover from surgery, and then start chemotherapy at least 2 months after your initial diagnosis. When all aspects of your breast cancer are put together to determine how best to treat it, such as the size, the type, the stage, your receptors, genomic assays, other factors, your breast cancer receptors are sitting there almost at the top of the list in how to make good decisions to treat your breast cancer. Get your receptor results early from your surgeon and from your biopsy and know what they mean. To learn more about breast cancer tumor receptors, visit the Breast Cancer School for Patients, where we will teach you everything you need to know. We're here to help you get the best possible breast cancer care in your community. Register on our website to get our list of questions to prepare you for your next doctor visit.